All right. Good morning and good afternoon and good evening, whenever you're following this podcast. My name is Erwin Ho, medical microbiologist in HOST ZNK here in Belgium. There's a very specific reason why I am recording this podcast in English, and it will be quite apparent quite soon. Just like every week, I'd like to start off with just giving a short overview of what we've been doing with HOST ZNK this week. We have finalized we have looked at some guidelines in terms of abdominal infections, also the directed therapies in those infections. We've also worked on antibiotic resistance figures for our hospitals. We've also continued our irregular registration activities in terms of infections that we monitor, like bloodstream infections. We've also done our orthopedic multidisciplinary tour grand rounds that we do every 2 weeks. We've also given a couple of trainings. We've given trainings in a nursery home. This is the second time we went to that nursery home. General infection prevention and control topics like hand hygiene, and also prevention of urinary tract infections, and also specific tips on outbreak of infectious diseases which are prone to outbreaks, like norovirus, clostridioides, and also scabies. We've also given a training just now today on the prevention of catheter-related blood infections. A very practical session where we actually had a couple of workshops that we weren't just giving like the explanation thereof, but actually doing it with some of the nursing staff here. Very interesting. We got a couple of comments there, and we will make adjustments and improvements to our workshops. And also we prepared our transition from HOST towards AIM, which is a next phase of our IPC and AMS program here in our Belgian hospitals. That's also what we have been doing. Next, I wanted to give you an update about the Ebola outbreak in the Democratic Republic of Congo in the east of the country. Right now, we are at about 1,000 suspected or confirmed cases of Bundibugyo virus. So this is the variant of Ebola that's currently having an outbreak in the east of Congo. 1,038 suspected or confirmed cases, and 241 deaths have been reported. Also, yesterday, there was an advice being put forward by the experts. It was convened by the WHO, and they were looking for therapeutics and vaccines, because for Bundibugyo, there are no approved vaccines and therapeutics. But they have recommended a couple of specific things that should be looked into and should be accelerated to be used in the current outbreak. In terms of the treatment of cases, they looked at two specific monoclonal antibodies, MBP-134 and meftivimab, and also the antiviral remdesivir, again, which we know from the earlier Ebola outbreaks and also from the COVID early days, or a combination thereof. For a post-exposure prophylaxis, obeldesivir is determined as a priority candidate. And in terms of vaccine, the WHO experts put forth two candidate vaccines. The vesicular stomatitis virus vaccine Bundibugyo, which is developed by an International AIDS Vaccine Initiative, or IAV, and also the ChAdOx1 Bundibugyo vaccine. ChAdOx1, of course, which is the chimp adenovirus Oxford vector virus viral vaccine, which we also know as one of the COVID vaccines. So this is the AstraZeneca vaccine, which also used the ChAdOx vector. Ervebo, which is the approved Zaire strain Ebola vaccine, is put like in the third tier. And this should only be investigated in very carefully designed research settings, but it looks like the WHO experts are more looking into these two other candidate vaccines. Of course, these trials need to be ethically well performed and safe. But yeah, these are the therapeutics and the vaccines that they are looking into. What's also changed is the public health advisory. While previously the WHO said to states not bordering the DRC is to just be vigilant. They do give the advice to be a little bit more than vigilant and to be actually prepared when you have, for instance, health workers coming back from the region to really properly care for them. And very correctly, the Belgian government has also released a quite comprehensive guideline for the management of Ebola, but also actually all hemorrhagic viral fevers. This guideline just dropped. We are currently looking at them with our IPC teams. So ziekenhuishygiëne in Dutch. What we need to do, these in a glance, these guidelines look very similar to the older guidelines that have been put forth in 2014 for the previous outbreaks, and they also include very specific case definitions, which is of course very important when we need to organize them. And also it states that the care of actual Bundibugyo or Ebola or suspected Bundibugyo or Ebola cases should be done in only 2 centers in Belgium. So this is Saint-Pierre in Brussels and the University Hospital of Antwerp. And also taking samples and all these kind of things. So lab work should only be done in these 2 locations. So in that sense, these new guidelines are very similar to the previous guidelines. But again, we are specifically looking into those with our IPC teams. So that is the update on Ebola. The reason I'm talking in English this week in the podcast is because I want to talk about Kyle Busch. So Kyle Busch is a very well-known American NASCAR driver. So he's a racer. He's a young guy. He's born in 1985. He's 41 years old. Of course, in elite sports, he's already a veteran. But this guy is a legendary NASCAR driver. He has 2 overall NASCAR Cup championships in 2015 and 2019. He has won over 230 races in all the national NASCAR leagues. So NASCAR is a little bit different from the most elite racing car series that we know here in Europe. So in Europe, mostly we're looking at endurance racing like Le Mans and stuff like that, or Formula One, of course. So F1. United States, NASCAR is bigger than that. They also have an open wheel series in the United States as well, which is IndyCar, which is also a very interesting motorsports series. But Kyle Busch was a NASCAR legend. And he has passed away at the age of 41. And the reason he passed away is he died from pneumonia and sepsis very suddenly, like last week. He passed away. How did this happen? He actually got a cold in the beginning of May. After a race, he already said to his team that he didn't feel too well. He had a cough which did not really improve, so after a week he didn't really feel better. He actually also went to the radio and said, yeah, I might need a shot. But he continued racing in multiple series. He also did some simulator work back at the plant. And it was during this simulator work that at the facility, he actually crashed. He was incapacitated in the bathroom there. Paramedics were called. He had very high spiking fever at the time. And he was still responsive, though. And he was coughing up some blood. He was rushed to the hospital. All necessary care was given, also given IV antibiotics, but he passed away the following day. So it started off with a cold, and then a sinus infection and a cold. It progressed most likely to a pneumonia, which was not treated for a couple of days or even weeks. Then it progressed to sepsis, and then he passed away. Yeah, so this is, again, a very public and very tragic example of how sepsis can be very lethal. So sepsis in itself is actually not an infection. Sepsis is a syndrome or a cascade of things that's happening to your body because there is a massive infection going on, but also a massive immunological reaction from your body. This happens usually to young and overall quite fit people. And the reaction of your immune system is so violent that you get some paradoxical reactions in your body. So you can get a blood pressure decrease. So these people go into shock. And despite the best medical care, sometimes you cannot save these people, just like Kyle Busch. So what happened here, I can only speculate. Of course, the medical files have not been released. And this is, of course, this is private and it's cared for by the family. And this is also purely my own personal opinion and comment on that. But I suspect it was most likely some sort of bacterial infection. Well, first of all, I think it's probably started with a viral infection, some sort of flu. And then you get a bacterial infection. So the bacterial infection comes after that or on top of that, which is most likely if it's a massive sepsis in an otherwise healthy young person, it's most likely going to be Staph aureus. And because this is the United States, it even could be MRSA, so the methicillin-resistant Staph aureus. So if you look at the timeline, you had the cold that started on May 10th, and then a week later the cough was like not improving. I think then you have the bacterial infection with, let's say, Staph aureus. He continued not to feel well. This could have been a time when antibiotics could be started. Usually, of course, hindsight is 2020, but at that time, you would think, okay, let's start some oral antibiotics, and most likely Kyle Busch would have been fine after that. But again, hindsight is 2020. It progressed, and then you get a massive infection of the Staph aureus that is not controlled because there are no antibiotics. You get a massive explosion of bacteria that's present and a very violent immunological response. And then you have the situation after the simulator, and you have his incapacitation in the bathroom, and then you probably already have sepsis. And at the time he's at the hospital, they take all his parameters, and they can only observe that there's sepsis. Of course, they give their antibiotics, but you have already that process of sepsis going on and the flourishing, uncontrolled bacterial infection. And then, of course, you can do your best, but then there is a very the possibilities of not surviving that is, of course, real. What can we do against that? It's quite difficult, of course, because was Kyle just tired? Like a week after May 10th, like May 16th, May 17th, he could have just been tired because this is a racing driver in a NASCAR series. There's multiple series, not just like the Cup series. You also have the second tier and also have the truck series. So it was just busy maybe. So how can you tell a sepsis? There's actually an acronym that helps you recognize the signs of sepsis, and that acronym is TIME, which is T, the temperature, if there is actual fever and if you can measure it. If there are signs of infection anywhere in the body, it doesn't only have to be a pneumonia. It can also be an urinary tract infection or even a skin infection or an abdominal pain. It can be any sort of infection. M stands for mental decline, when you have sudden confusion or disorientation, drowsiness, and all of these things must be out of character. This is like, for many of us in the medical field, this is like the red flag. When you have someone who's young and otherwise healthy, when they say, I'm just extremely tired right now, or I don't feel good, and you don't expect them to be this way, it's not just medical professionals, it's also like your family, or when your spouse or your partner, when they tell someone, hey, what's up with him or her, I think something's up. Or if this person says it themselves, I don't feel so good, I need to lie down or something, in an otherwise healthy person, then you need to be careful. The E stands for extremely ill. Of course, that's May 19th, May 20th for Kyle Busch, when you're already incapacitated. Of course, that's an obvious sign. It's that mental decline that we have, like a saying in Dutch, which is called het niet pluisgevoel. And this is like, in English, plainly, something's up. When you have like a feeling, you cannot put it into words or into objective signs, but you know something is up. And then that's why you need to take care of those times and think about sepsis. And why is that? There is also actually a pathophysiological reasoning or explanation behind it. There's always what I call a triangle of infection. You have the pathogen that's causing it, but you also have your host factors and also your treatment. And when the pathogen is very aggressive, like the Staph aureus here, and if there is no treatment at all, then your host factors come into view. And the deceptive thing is, if your person in which this is happening is a young, healthy person, then all of these signs can be delayed quite significantly. But when these signs do come up, they fall off a cliff. And that's why Kyle Busch happened. He's definitely not alone. There's thousands of Americans dying every year on sepsis, not just Americans, in Belgium as well, where I'm currently at. And it's really a big problem that's not sufficiently known in the general public and also in the medical field. And that's why in Belgium, for instance, there is this group called Sepsibel of former patients who are very bravely telling their story and trying to inform everyone, general public and medical field, about their experiences and how we really must be very attentive and careful of the signs of sepsis and massive infections and how we must treat them. So yeah, again, hindsight is 2020. Rest in peace, Kyle Busch, a great racing driver and NASCAR champion. And us in the medical field, we can only learn from whatever happened to these people. So take care, see you next time, and bye-bye. Cheers.